so you're aware.
Hi, I'm Nicole.
Hi.
How are you today?
I'm doing okay.
Alright. And can you tell me your name?
My name's Sally Smith.
Sally Smith. And Sally, what's your date of birth?
1/2002.
1/1/2002?
Yeah.
Okay. Well, Sally, my name is Nicole. I'm a nurse here. I just wanted to talk to you a little bit today. Could you give me an idea of what led you in to come in today?
Yeah. My anxiety's gotten pretty bad.
Your anxiety? Okay.
I've been having panic attacks.
Mm-hmm.
It's kind of keeping me from doing my job.
You're doing your job?
I am going to school, so I kind of need some help.
So you have a job and you're going to school? Is that
Yeah.
right? Okay. And you've been experiencing some panic attacks. Okay. Can you tell me a little bit about your panic attacks? What is that like for you?
Yeah. I get really, my heart beats really fast, and I feel like I'm gonna pass out, and I feel kind of dizzy, and like I can't. I feel like disassociated from wherever I am.
Disassociated from wherever you are. What do you mean by that? Like, what is that like for you?
Like I'm watching my body instead of.
Okay. So Sally, I'm just taking a few notes here to help me remember everything that you tell me, and so I can look over it and think about it too later on. Okay.
Okay.
Alright. A couple of other questions. This sounds. First, I'm gonna say this sounds unpleasant. This sounds hard. Does it feel difficult?
Yeah, I sort of can't keep going on.
We can't keep going on. Okay. So Sally, when you tell me that you feel like you can't keep going on, is that right?
Yeah.
I'm wondering a few things that I want to ask you. I did want to ask, when you say that, do you have any feelings or ideas of suicide for yourself?
Yeah, I've been thinking about it because I'm just so worn out from trying to live like this.
Do you have any plans or any thoughts, anything beyond just thoughts of not wanting to be here?
I've been thinking about cutting my wrist, but I like don't really want to. It's like a thought that I can't get rid of.
Like a thought that just passes you by, or do you?
More like it's always there and I can't get it to leave.
Okay, so it's always with you. Okay. Do you have any thoughts ever about harming anybody else? No, just yourself. And it's always with you?
Yeah.
Okay. You ever made a plan or found yourself attempting?
No.
Okay. Thank you for telling me, sharing that with me. Is this something, so you said that you're having panic attacks, you're not feeling well, you're tired, is that right?
Yeah.
Is this something new for you?
I've had panic attacks since I was 16.
Since you were 16, okay.
I think just with stress in school, I've just been getting worse.
Can you tell me more about the stress with school?
Yeah, I'm a chemistry major, and this year is like kind of the most important year with all the kind of hardest classes. So I just sort of feel like I don't belong, and that
worked very hard to be here. What things, tell me more about what's not going well with school or your job? Are those the things leading you to feel some panic?
Yeah, I think just like I have so much to do and I can't seem to keep up.
Tell me more about that.
Kind of just no matter how hard I work, I can't seem to get the grades I want. I just feel like I'm always playing catch up. I feel kind of like I'm in a fog, so it's hard to learn.
Okay. Tell me a little bit about what you're, how are you sleeping?
I like wake up a lot.
Wake up a lot? What do you do when you wake up?
I usually like try to go back to sleep and end up on my phone for a while.
Okay. Sure. How about eating? How's eating?
I don't really have much of an appetite.
Okay.
I just feel kind of nauseous when I try.
Okay. And maybe you could tell me, in your circle of people, how many people who do you really think you're really connected with or you can depend on?
My roommate is really nice.
Okay.
She's a business major,
Mm-hmm.
and like they just don't have as much work to do. And I'm not mad at her, but it's like hard for her to understand how much responsibility I have.
Okay. Is there anyone else you feel close to or that you could confide in?
I have a classmate that I study with sometimes,
Okay.
but she's doesn't seem to struggle at all, so I'm kind of nervous to ask her.
Okay. How about family?
My parents live in Des Moines.
Okay.
They're divorced, so they don't talk to each other. But they're nice, but they don't really get it either. They're kind of just you pull yourself up by your bootstraps and get back to work.
Okay. Are you involved in anything outside of school or your job?
I used to play on the rec league soccer team,
Okay.
but I've just been so tired I haven't had the energy.
Okay. What about any volunteering or any church or involvement?
No, I'm not opposed to it, I just haven't done it.
Sure. And you're saying you have had panic attacks before?
Yeah.
When did those take place or
In high school,
in high school?
I was in a really bad car accident,
Okay.
and I had to go to rehab afterwards.
What rehab, were you injured?
Yeah,
Can you tell me about that?
yeah, I broke my hip,
Okay.
my ribs, so I started to have flashbacks. Was afraid to drive, afraid to do anything really for a little bit, and I saw a counselor and I whole year, my anxiety has just been building until I get to this point where I can't stop having anxiety.
Okay. When you were car accident, it sounds like that was really difficult.
Both the healing physically and just emotionally from what took place. Yeah.
I'm wondering, after this, the counselor that you were seeing, were you prescribed or given a diagnosis of anything?
I'm not sure.
You're not sure? That's
I don't think I took any medicine from them.
No medication at that time. Did you take any medication for your pain, for your hip or ribs?
I did at the time, but I don't anymore.
But you don't. Okay. So I'm gonna ask a couple of other questions, Sally. I'm just gonna ask, do you take any medications or do any recreational drugs?
I smoke weed sometimes to try and help with my anxiety. But then I don't feel like it helps me with school, so I don't like it. And then I just take a multivitamin and birth control.
So you said that you smoke a little bit of weed for your anxiety, but it's not, not sure it goes well with school. How often? Would you say weekly?
Probably 4 times a week.
About 4 times a week? Okay. Do you find it does help with your anxiety? It does.
But then I don't feel like I can focus on schoolwork, so it's not helpful in that way.
Okay. So how else do you think we could help? You want some help with your anxiety? What kind of things would you like to try with that? Would you like to try some different kind of medications? In the past, you had seen a counselor, and that helped you at that time with your panic attacks.
Yeah.
Do you think that would be helpful this time if we set something up with someone?
Yeah, I just don't know how to find one and if my insurance will work.
Okay. We can look at that with you and find something that both your insurance would work and hopefully will work with you and school and your job. Okay?
Thank you.
Mm-hmm. What else do you want me to know?
I probably need a note for class today.
Sure. Okay. I'm so glad you came in to talk with us.
Thank you. Great.
Okay.
I can sign your sheet here. I can't remember. Did you ask me about hallucinations?
I don't think I used the word hallucinations. I asked if you saw anything. I think I phrased it that way. Any feedback?
No, you did wonderful. Very nice, manner, very giving the person space to respond. It can be hard, to use that silence. But you did a very good job.
I do that with my preaching a lot.
What do you think?
It's just like, have no reaction, no opinion.
Yes, I can tell that you've done this before.
No reaction, no opinion.
Yeah, no, and it serves you well because, you never know what a patient's going to say. And patients have been through extreme trauma, or they may have committed crimes, or you just never know. And
You never know what someone's gonna say to you. It's like,
patients tell me
very interesting things.
very wild things,
Yeah.
and you're just
Yeah.
yeah, I don't